Hey, benchwarmers. I feel like we need to go on to social media a little bit just to make sure everyone's okay with being called benchwarmers. I don't know.
Fuck 'em.
Fuck 'em? Yeah, okay. Fuck yeah. No, I'm kidding. Ooh, don't come for us, please. What are we doing today? What's this one
Common
about?
misconceptions in
Yeah.
physiotherapy.
Also, I feel like we should address, we're on the floor because,
We'll just ignore the fact that we've already filmed an entire
again,
episode.
we have already filmed an entire episode. We do bulk episodes. But we're on the floor because you've just moved.
I've just moved.
Yes.
I have a new place of residence.
Yes. Well, we're not going to say the address because
I was about to.
But we just, again, use your imagination.
Imagine we've got a poster or a light.
Poster, yeah. If
Sponsors?
you're on Spotify,
Yeah.
it doesn't even matter.
Yeah.
But YouTube, yeah. Anyway,
And
sorry.
we're on a couch, really comfy couch.
This is a very comfy couch.
So we're just organising the setup.
This is really good
Figuring out the
ergonomics.
Yeah. Physiotherapy,
Yes.
common misconceptions is that you need chairs.
Yeah.
But
yeah.
you don't.
We should just do some stretching while we're talking anyway. Anyway, so we're going through common misconceptions in physiotherapy today.
Physio.
Good job.
Put the timer on.
yeah,
Forgot to put the timer on.
Yes. Yeah. What's well?
Okay,
you
so
lead it then.
basically, we've just got common misconceptions. I thought we could go through, discuss them,
Yeah.
and see what the evidence actually says.
Okay.
Number one, this is like a real big pet peeve for me, and I feel like it will be for you. My spine is out of place and needs to be put back.
Yeah, I don't think you'd be
How do you-
moving if your
Yeah.
spine was out of place.
I cannot, like, I get it. I feel like, okay, I shouldn't like hate on people for saying stuff like that.
Yeah.
Because I get that, like, that's what is kind of like construed to people.
Yes. Usually by chiropractors.
Usually by chiros. But
My hips are out of alignment.
if you're out of alignment or like out of place, that means you have like a dislocated or like something is structurally
Yeah.
out of a like place with your
Yeah.
body, and that is not something that physio can fix.
No. Yeah.
Like, it
yeah.
can help
I
with a
can't
rehab.
pop it back in kind
Yeah.
of thing.
Um,
Unless it's like,
Yeah.
probably need to go to the emergency or something.
yeah, so like saying like my spine is out of place or like my hip's out.
Yeah, yeah.
My, something is out. Yeah, I just, we need to educate people better because
Your feelings are valid.
feelings
but,
are valid. Like, you can be sore and something can feel not right, but like using words like is out of place or out of alignment or is twisted.
Yeah.
I think those kind of languages need to be moved away from because they're not actually accurate, and I think it can kind of just create this
Yeah, I agree.
like negative kind of connotation with that.
Yeah.
But anyway, that's
Also, if I was a patient and someone came to me and said, "Oh, your back's out. Your back's out. It's out of alignment, or it's not in the right
What does that
spot."
mean?
I was like,
Yeah.
"Really?
Yeah.
Oh my god!"
Yeah.
And like, you would just catastrophize.
yeah,
And you just
that's
think,
exactly right, and that's exactly
so,
right. Like, so. Yeah, I get frustrated with that. Have you ever been told something's been out of place? I've been told that my neck was out of place, and by a chiro. I went to see a chiro. Literally, I went to go see a chiro because the physio versus chiro debate, and I felt like it wasn't fair of me to judge all chiros based on. You can smell the burning too,
No, I was
right?
going to sneeze.
Oh,
I think
okay.
I can smell the curry or something. I don't
Yeah,
know. Yeah,
so that's
sorry.
really what it is.
Sorry.
And so
Yeah, you wanted to just...
I wanted to be able to, like, give them a chance kind of thing.
Yeah, fair. And they failed.
yeah. They told me that.
I'm kidding, sorry.
They did.
Yeah.
They told me that, like, they told me that, like, my C4-5 was out of alignment and I would need, like, 2 weekly sessions for 6 weeks, and then I could do weekly sessions at that point to see if, like, they could keep it in place.
Yep.
I also had a friend who got told by the same chiro that the same chiro business, not the same chiro, that he had a subluxed, so like partially dislocated, like thoracic spine, like multiple segments. And then the next week when he went back, it was that he was hypomobile. He was too stiff.
Hypo.
He went from being subluxed to too stiff.
That makes complete sense, doesn't it? That
Logic.
makes a lot of common sense.
Absolute logic. But anyway, So that's common misconception number 1 is that things can be out of place.
Shouldn't hate too much on chiros. I think there are some good chiros out there.
I agree. There's some shit physios.
There's a very fair.
Yeah.
Yes, there you are.
I just like evidence.
Yeah, me too. Yeah.
Number 2.
Yes.
If my muscles are tight, they need to be stretched more.
Oh, okay.
What are your thoughts on that?
I think also tightness is weakness.
100%.
So they're tight because they're weak, and they're getting overloaded because they're weak.
Yeah,
so,
exactly.
Yes, stretching can help, but you also need to make them stronger.
Yeah. I would also add that tightness isn't due to muscle shortening. I think a lot of times people think that they've got like shortened hammies or something because they're tight.
Yeah.
And it's basically just an increase in muscle tone, not muscle length. And stretching can help reduce muscle tone.
Yep.
It can also help reduce increase muscle length, but it's I'd agreed, weakness generally versus
generally. I mean, if you're sitting down all day and you've got tight hammies, you're sitting and down all day in a bent position. So yes, moving and stretching is helpful, but
absolutely.
But yes, not just stretching. Yeah,
is the end of it.
Yeah.
Cracking your joints causes arthritis.
I mean, what's the research on that, Hannah?
The research on that is that it doesn't.
I was going to say, I didn't think it would.
The research, so cracking your joints, for people that don't know, when you crack your joints, or you pop your joints, or whatever you want to call it, it's basically just gas bubbles in the synovial fluid being released, and that's what kind of makes the noise. It generally feels actually pretty good.
I think there's a difference between cracking and clicking.
There is, absolutely.
Yeah.
When you, I was gonna say,
some people's necks, I hear them. I hear their necks when they turn.
My neck does that a little bit.
Yeah.
Not nice. No, cracking your joints is fine as long as it's within their normal range or normal limits. You get into trouble when you're going past anatomical range. Don't do that. That's not good. That's when you end up with an injury. But there's no evidence to say that cracking joints develops in arthritis. My mum used to get mad at me for cracking joints because it would cause arthritis.
The people that can just crack their necks, I'm just I wish I could.
I was that's me when I do that. I do that all the time.
I've had a patient though say that his neck cracks, but then he does this. And I'm just I don't love a circular neck motion a lot. No, it's not great.
That's not great.
So I told him, can we just do 2 movements? Can we not do the whole...
Can we not whiplash, break our neck kind of thing?
But yeah. Okay. Cool.
Damn. Yeah. Rest is best for injury recovery.
Within reason, no. Well... It's rice, but now it's also police, isn't it?
Yeah.
Which is, what's the PO now? Optimal loading?
There's protect, optimal loading, icing, compression, elevation.
Yeah. So that pretty much means do what you can. I think it's always good to do something rather than nothing. Particularly if you're a runner, and you've done your ankle or something and you can't run for so many weeks or whatever, why don't you still do cardio on a bike or something? You know what I mean? There's other things that you can do to maintain your level of fitness so that when you can go back to those high impact activities, it's not 0 to 100.
Yeah, exactly. Well, that's the other thing as well that I think a lot of people, should consider, or physio should consider, is the cardio side of things. I find a lot of times people they'll tear their calf or hammy or something like that, and then they'll stop everything for weeks, and it's you could still be doing a ski erg or anything, still having that cardio fitness, because how are you expecting to go back in 4 to 6 weeks and pick back up exactly where you were? You won't if you've not been doing anything.
I love gym bros though who'll just have the moon boot on and still go.
That was me. That was literally me for months. I was just I can't do anything except for upper body, and I hated it. And I was in the boot
You were swole.
I was swole. I was so swole. It's like full Dorito. Yeah, exactly. That's exactly right.
Yeah.
So no, rest is not always best. There's, I guess we kind of touched on it last time as well. There's a rest period, and then you build up into your rehab.
Yep. If it hurts past a discomfort, like yes, you probably don't do it. But if it's only just a bit of uncomfortability, you can be uncomfortable, but not
Next one's interesting, and again, like maybe a topic that we can discuss in a lot more detail is pain always means damage.
Not always, no. Yeah, so, you can delve into a lot with that. You can
delve into a lot with that.
Chronic pain particularly as well, yeah.
So, briefly put, if we were to describe pain.
You can have that one,
I find it interesting. I find it really interesting. I don't love all my chronic pain clients just because they can be quite challenging. They are quite challenging. They're also rewarding, I guess. But pain is a warning system, not relative to tissue injury. I think it's the most simplest way. So if you think you get the warning system before you have structural damage, if you think about that pain is that warning system before you have structural damage, I think it makes it a lot simpler to kind of break down. So once you have obviously gone past the point of structural tissue damage or tissue injury, that pain threshold drops right back. So tissue tolerance is still up where it should be, sometimes maybe a little bit down, but your pain threshold drops quite significantly, and that's why you can have pain after an injury. But also, if you have pain that hangs around for a long time, your body becomes really, really good at producing pain as a warning system. And so that pain threshold will move away even though the tissue tolerance won't change. So no, pain is not always relative to damage always.
I also find people get these, for lower back in particular, get these lower back scans and it says what every single
that's
person's
also one of
back.
these.
Oh, okay.
Yeah.
Should we move on to that? Or
No, we'll go into that one. So you need imaging to diagnose pain?
Well, no.
Yeah.
No, but like I was saying, with lower back pain, you get an X-ray and it says, there's degenerative changes.
Terrible things.
Yes.
Yep.
Yeah.
So those scans, and this is something that I always try and educate my clients on, those scans, so when you get a scan done, a radiologist, get it right? A radiologist.
Oh, radiologist.
Yeah, because radiologist reports on it. So So a radiologist has to report on everything that they find in that report. They can't comment on just the relevant things that you're putting in your clinical findings or referral for. They have to report on absolutely everything that they see. So you're
really? I've had some only.
So they might they might only be looking for something.
Yeah.
And so they'll report on that. But technically they have to report on everything that they find. So that's where you end up with significant disc degeneration or things that aren't really relevant to what you think clinically. Those images are also being compared to a perfect specimen, a perfect 18-year-old specimen with no degenerative changes and things like that. And so a lot of times people will come in and they'll say, I've had this X-ray, I've got disc degeneration. It's you and every other person in the world.
Yeah, exactly,
It isn't always. Sometimes it's relevant, sometimes it's not.
Yeah, I agree.
And so I think, it's also interesting. How do you go with your non-specific low back pain and things like that? Because I find that an interesting.
Yeah. With
how do you
imaging
educate?
or with definitely
from imaging.
Yeah.
What is non-specific low back pain?
It's not specific, is it?
Non-specific. It means that there's
no structural cause.
No structural cause.
Which is about 90% of back pain or something?
I think it's actually higher than that.
95?
Yeah, I think it's 95.
95% of back pain is
non-specific low back pain. Do you tell people that they've got non-specific low back pain?
Not really.
It's such a confusing term. No. I don't tell people that either. I'll normally kind of explain whether or not I think it's likely a facet or a disky kind of presentation. But non-specific low back pain, it means that there is not a disc herniation or a disc bulge. You might have those things, but it just means that your back pain probably it's not the source of those symptoms. But it could be it's more of a biomechanical way that your body moves that causes you pain. But there's not a structural cause for it. So it's not like a broken bone or a torn ligament or something like that. It's more about the movement. So you don't always need imaging. I find that really interesting. It can be really helpful. And there's some things that make a lot more sense having imaging done. But imaging isn't always helpful, I find.
If anything, it can kind of catastrophize people a little
things.
bit.
Yeah, absolutely.
More,
I've had, you're probably the same, lots of people that have come in and kind of gone, oh, I've got, disc degeneration is kind of one of the, or degenerative disc disease, is one that people are like, oh, I've got degenerative disc disease. And it's like, that just means you have aging in your back.
And you're 60, so
you're 60, so that makes sense.
No.
Yeah, so I think educating people, and that kind of almost comes back to my joints out kind of thing. We just need to educate people better, I think.
I think people need to be, they also think disc bulges don't heal on their own sometimes as well and stuff. So I think there's a certain percentage, and you have to look at the research of this, but like the fact that, you know, some people might even just have disc bulge and they be asymptomatic as well. So, So exactly. Whether or not that actually is the cause of your symptoms.
But there's also some really interesting, again, have to like go more specific, but there's some really interesting like information about people that don't have ACLs, people that have ruptured ACLs and are completely asymptomatic.
Yeah.
And it's actually like in Australia relatively high, which is so interesting, that you can have people with like, oh yeah, you've got no ACL or you've got no this, and you wouldn't know. You wouldn't know because they're like perfectly functional.
Are they playing high-level sport?
Yeah, some of them are. Yeah, some of them are, which is interesting.
Just rehab the crap out of
Rehab the shit out of them. Physiotherapy is just about exercise.
Yeah.
We don't want to touch you.
Otherwise, you're an EP. You're an EP if it's just about exercise, right? Realistically. Yeah. An EP is an exercise physiologist.
Physiologist.
The only difference I feel like is the clinical reasoning or the diagnosis. We can diagnose you, and then obviously manual therapy. We can do a lot of that. But no,
I feel like a lot of physio is early stage rehab as well. A lot of EPs I've always kind of worked with, or not always, like some of them are fantastic and can do like that early stage rehab as well. But I find a lot of EP tends to be a little bit more later 100%. Stage rehab. You kind of go through your physio and then you transition in, as well as like your maintenance and injury prevention sort of stuff. They can help with that quite a lot.
I also feel like we know movement a little bit better.
Yeah, and
like
anatomy.
Gait and like getting at it. Yeah, I feel so. It's always good to have both if you can, but I agree with the early stages for sure. But sometimes if it's not really EP's not really doing, maybe we can delve a little deeper into it as well.
Yeah.
But yeah,
absolutely.
But no, not
just exercise. We do other things as well.
I feel like people actually do hate potentially coming to the physio because they don't like doing exercise. They've never done exercise, and they're like, oh, they're just going to make me do exercise. Yeah. But then it's so good having people who've never done exercise before and get them to do some exercise. And like, I feel so much better. I'm going to keep doing this. I'm going to join this class and blah, blah, blah. It's so rewarding.
Actually, I love that. Yeah, that's good.
Yeah.
Again, kind of last episode, manual therapy can cure injuries on its own.
Not on its own, no. And that goes back to, last episode of manual therapy and exercise prescription being together, as well as advice and education.
Yeah.
So, yes.
No. Only athletes or people in pain need physiotherapy.
No, I've actually had a lot of people do preventative stuff.
I was going to say, it's I think becoming a lot more known to do preventative.
Yeah. I think obviously you see physios in elite sports now, and they're doing a lot of the prehab stuff, which is good. So for specific sports and things like that, so that's good. I've actually had a couple of people who started running, and they're a bit older or whatnot, and they have a marathon coming up and stuff, and they're just like, I just want to make sure I might see you every couple of weeks to make sure I'm going okay, and do a bit of manual therapy.
I was going to say load management as well. Get some advice on that. I was going to say.
I love people that come in before an injury. I wish a lot of people would do that.
It's pretty good.
It's so good. Yeah. but yeah, or even they know that they've, previously broken their ankle ages and ages ago, and they're like, I just want to make sure
everything's going okay.
Everything's going okay. I'm about to do this, or blah blah blah. So preventative is also
good. You should avoid movement when you have pain.
No, well, I think that is back to the rest, isn't it? A little bit of that rest as well. Movement is medicine as well. Loading. Optimal loading, yeah. It depends. It depends. It depends on the level of pain, I think.
Yeah. What's your cutoff for pain normally? Like, what do you tell patients? What's your 0 to 10?
Discomfort's good. I usually say anything past a 4. Numerical pain scale, 10 out of 10. What is your 10 out of 10? This is how I describe it.
Everybody changes things. I say on a scale of 0 to 10, where 10 is worst pain imaginable, 0 is no pain. Where are you?
I go 10 out of 10, worst pain imaginable. I need a hospital. I'm in so much pain. I make that clear.
Very clear.
I make that clear. One of my colleagues, Michael, lovely Michael.
Shout out.
We have shouted out to him before. Uses the orthopedic version or something, and I think his version is like where you're about to pass out and like, I don't know, you're in so much pain. I have to ask him again, but his version, I'm like, okay, that's very
specific.
That's very specific. But it's so subjective. People's pain levels subjective, because like I said last episode, copers and non-copers. Yeah. People who can cope with pain are probably going to say a bit lower than what you would think, and then others would say.
Which is also, I think, really interesting from like a management perspective as well, because sometimes people with I always find it funny when people are like, I got a really good pain threshold, and you're like, honey, no you don't. No, you don't.
Also, women who have had children have a very low,
I
have a very high pain tolerance, and they'll say, oh, it's fine, and I'm like, well, you've been through childbirth, so your level of pain is like, this is your 10 out of 10, and this, but I feel like also people who haven't really experienced pain before, they think it's quite high.
Significant.
But so I do find people who think, but is that the chronic pain people?
Yeah. They're like, I guess,
because I'm like, I'm so used to pain because I'm in pain all the time, and I'm just like, well,
but it's like but they'll also be like, oh, it's a 7 or 8 out of 10, and I'm like, but you're existing as a normal person.
That's very true.
So it's
it can be very subjective and very hard to tell. So sometimes I say for that question, if it past 4 out of 10, we want to stop. But then I'll also say I kind of reiterate and be like, it's okay to be uncomfortable, but I don't want like
don't want it to be painful. Pain. I feel like I get asked that question. Not super often, but every now and again we'll get how uncomfortable can it be? 4 out of 10 on pain scale. 10's worst pain imaginable.
It's hard when they're already at like a 5 or a 6 as well.
Well, that's when I'll normally kind of go like, okay, pain relieving exercise. What can we do to try and reduce your pain? But it's kind of funny. I think pain's really. We'll have to do a one on pain.
It's
just such an interesting.
It is very
complex.
I find it complex.
It is complex. Like it's
all in your head. No, I'm kidding.
Beck's just taken us back 50 years. Little study of pain with that statement.
But we should definitely do.
It's just interesting.
Maybe very far down the line.
We'll get Lorimer Mosley.
Mosley. I actually like how he describes it.
The way that he describes it. If you got pain, lots of chronic pain, Tame the Beast, Lorimer Mosley. It's my go-to video, just because I think he explains it very well. Explain Pain book. I just think it's interesting.
It is very
interesting.
I
don't really love chronic pain patients, but I just find pain and chronic pain very interesting. So, no, don't avoid movement when you have pain.
No,
optimal loading.
It's always and you want to be progressive. So you need to start somewhere. So,
a lot of people now as well with like ankles. I found this out relatively recently. Is they're not moon booting. Well, they are, but they're only for short stints now. Yeah. A lot of it is about getting like early mobility back into the ankle, which I think is pretty interesting. Yeah.
Also, moon booting is terrible for swelling.
Oh, 100%. Yeah, absolutely. Yeah.
It's always like, I love a good box. We did this last time. It's not box. It's basket weave. I keep calling it the wrong thing.
We know what you're talking about.
Boxes.
We know what we're talking about.
Anyways.
I was just like, for your back?
For your ankle. But yes. Yeah, I agree that they're trying to get... even with surgeries now, post-operatively, they're trying to get you moving as quickly as possible. Yep. So, they do it after surgery. You think, you know.
I always find it funny. I always think it's so funny though when people are like, I had my knee replaced and I was walking later that day. I'm like, yeah, you were. Yeah. Damn straight.
Yeah.
Go.
Have you ever seen a knee replacement, actually, video?
No.
Oh my gosh.
I know how it's done.
Yeah. But the thing is, they check that you've got the range afterwards. Yeah. Like, they move it. So you've got the range.
So you've got the range.
It's just all that swelling and all that.
It just hurts.
Yeah.
That's what, like, I think one of my big pieces that I'll normally tell people as well, like, post knee or hip, I'll kind of be like, or particularly knee, I'll be like, the rehab sucks because you're going to hurt, but you got to do it.
Yeah, exactly.
Sorry.
Right.
Physiotherapy results are instant?
No,
they're not. Sorry.
Love that.
Yeah. Sometimes I find people funny when they're like, yeah, exactly. No, I'll see you next week.
Yeah.
No, I find it funny though when people are like, oh, it feels, you know, a bit better. And you're like, yep. And you need to go do your exercises now and then it'll feel a lot better. Yeah. But funny.
I do get some people that come in and do like, only 1 or 2 sessions and they're much better, and that's because they keep doing their exercises and whatnot. Yeah. But yeah, usually. How do you find with, I mean, setting out your timeline of when you're going to see somebody and stuff? Is there times where you'll see them twice a week for a period and be like...
Depends how sore they are.
Yeah.
Depends how much they are going to benefit from manual therapy.
I know, yeah.
So like an acute back, I'll normally see them twice in a week at least. Well, yeah. If they're just progressing exercise-wise, early stages, I'll normally go weekly for a couple of weeks, unless they're progressing really quickly, and then I'll probably still see them every week. If it's something that's a little bit slower, like the guy that I had with like his LCL and ACL, I think I saw him weekly for 6 to 8 weeks while we were changing his brace. And then after that, we started seeing each other fortnightly just because he was like progressing really well. And then we went monthly, again, just because he was progressing well. If people are not compliant with their exercises, I've got a girl at the moment who's, lovely, but she's not she's better now, but she wasn't super compliant with her exercises, and so I was seeing her weekly to be like, just because I found like she just wasn't doing them. Like, okay, well, I'll see you next week and we'll see where you're at, and
that's fair.
You
very similar. Yeah. I find if it's difficult if manual therapy doesn't have a massive change. I probably try to see them a bit more weekly and see if we can deduce what else. More the exercises more than anything. But yeah.
Totally. You need to stretch before exercise to prevent injury.
I mean, it can actually
can increase your risk of injury.
It can increase your risk of injury if you are tight and things like that.
Yeah. So stretching doesn't significantly change.
No. I know foam rolling can change your performance, apparently.
Yeah, I think that's... so your dynamic stretching and those more active...
Oh, okay, sorry, yes. Yeah, I better.
But static stretching is...
No, yes.
Don't be doing that.
I agree in that one. Sorry, I was thinking yes.
Yeah.
Yep, no.
You should avoid lifting if you have back pain. It's a really high-pitched noise.
I guess.
You are the more likely. I take that back on the...
I guess if it hurts, don't do it.
Yeah. Lifting technique, I think, is just kind of what it comes down to.
Yeah, well, yes.
And then the catastrophizing of things, like you've said. I think just avoiding that fear kind of behaviour. Physios are glorified massage therapists.
I've heard this so many times.
I've heard this so many times as well. Fuck off with that.
Yeah, fuck off. Hey, if you want a very good massage therapist, then yes, come on. But no. Oh man, I didn't do a 2-year masters and a 4-year science degree just to be called a
glorified massage therapist. Oh,
yeah,
that pisses me off.
It does. Yeah. No, I think we definitely try and delve in a bit deeper and try and educate and exercise prescribe and all that fun stuff for you. So yeah, I don't think glorified massage.
No.
I do think there's potentially physios out there who just do manual therapy and
100%. Yeah. I had a lady who came and saw me a day. So she went and saw a Bowen therapist.
Oh, yep.
She had a big fall, fell off a step, landed on her hip, couldn't really walk very well. And then she went and saw a Bowen therapist who did just like a bunch of glute release work. And then she came and saw me the next day and she was like, I just want more because I saw my Bowen therapist and it kind of helped for a bit, but then it's really quite sore now. And I had a bit of a look at her hip, obviously, like assessed it, and I was like, nah, we need to get an x-ray because it's like something's not right. Yeah, anyway, she like really was anti getting the imaging, really anti it. And I basically like pushed and pushed and pushed to get this imaging. And I felt so bad after she left because I was like, I think I pushed too hard to get it. Anyway, no, she came back. She had a superior and inferior pubic rami fracture. So,
oh, wow. Yeah.
So I was like, okay, thank God I actually did. So I'm not a glorified massage therapist.
Yeah.
Bowen therapy.
Do about everything, honestly.
Yeah.
Freaking doctors. Yeah. Your psychologist. You're friggin'.
No, but it is. There is. You are like bloody therapist.
You're pretty everything, honestly. So yeah, no, we're everything.
We're not just
glorified massage therapists.
Yeah.
Also, I feel like we're doing other people's jobs half the time with like we're trying to sometimes.
Yeah, absolutely.
So you need to know a lot of things. And I think that's just going back to uni and stuff. I was reading this on social media.
Research.
It's research.
Yeah.
But physios tend to burn out from this profession because coming out of university.
Yeah.
Because we feel like failures.
Yep.
Because there's so much pressure to know what's going on.
Yeah.
Everything in the body, and that's a lot.
Yeah.
To,
burnout rates in
physios
is really quite high within, I think it's the first 2 years, they say.
So we're not gonna know everything, but that's when we refer on, and that's what a specialist or someone who's a bit more qualified is meant to help us with. But even then,
massage therapist.
Anyways, yeah.
And then pain equals damage equals doom was the last one.
Dun dun dun.
End of the world.
No. No, definitely not. No. Again, I think we already touched on pain does not equal damage anyway. So,
not the end of the world.
No, not the end of the
world.
Not
the end of the world.
Oh, it comes back to that chronic pain or just pain in general, and how like your mental health and we'll talk about that. Comes into it a lot as well. Like if you have neck pain and it's a lot to do with posture and whatnot, but if you're stressed out, lot of stuff's going on in your family life.
Yellow flags.
That can also exacerbate a lot of your pain as well. So I think that's where we come into that psychology side of thing, is that we don't, and it's that holistic approach as well, is we don't just look at the structural side of things, but we look at your entire body and
everything that's kind of
going on in your life.
Yeah.
But so no, I don't believe that at all, obviously.
Agreed.
Dun, dun, dun. Yeah.
Of the world. Any other like common misconceptions or any like funny things you've heard in the clinic, or kind of put me on the spot here with this one?
Golly gosh, no. I didn't think of it. You were meant to.
I did. Yeah, cool. I feel like we've covered a lot of them anyway.
I think we have. If anyone has any, obviously DM us and shoot us
a message.
Shoot us a message. Oh my gosh, please voice message. I love voice message. But if you just want to comment or whatever,
but make
that's
it
fine.
interesting because we'll read it out.
Yeah, but we'll also answer any of your questions or what you think. You'd like to know, but yes.
That'll be, interesting. Do we have a from the bench? Any injuries?
Do we? Yes. I have one, and my phone's being used. I'll have to try and remember it from. This is from a friend of mine called Scooby.
Scooby. Hi, Scooby.
Yeah, I'll just call him Scooby.
Hey, Scooby.
He sent one in saying that, he is an AFL. Actually, I might even get him on the show one day.
Oh, come on.
Yeah, he's an assistant. I think he's the assistant coach for. Actually, I don't know if I should call him out. Actually, he's an assistant coach of a women's AFL team, which is pretty cool. But he broke or had an avulsion fracture on his thumb from just doing a handball in an AFL.
Can we get the circumstances on that, Scooby?
I have no idea.
Scooby?
I have no idea, Scooby. So
we need some more details because that seems a little bit like How?
Yes.
How did that happen?
Yeah. He's a bit older, so no, sorry, Scooby. But yeah, he did do that, and I thought that was quite funny because I was like, what are the odds of doing that?
Yeah,
just by
palming off a ball.
Yeah, unless he was going like this.
Yeah, thumbs up, mate. Yeah, let's go.
Idiot. Have you had any funny ones or? You know what I had when Lime scooters first came out, that I had so many people coming in with injuries with the Lime scooters and whatnot. And when I went to Europe, and they scooter over there so much, again with your biking story, but I didn't hurt myself.
Photos uploaded, by the way.
Yes, they were, and they were glorious.
Because they are the most embarrassing thing that's ever happened to me, I think.
Yeah, but I was on my scooter, and I think this is where you shouldn't phone and drive kind of thing. But I was trying to look up, because I don't know where I'm going.
Are you allowed to phone and scoot?
I don't think so, but I was trying to GPS and I was trying to look where I was going.
Tried.
And I stupidly took one hand off and went like this, and then I had to...
Speed wobbles.
I did what you did. I think I had to eject and abort, and I let it go, but I was still going that velocity or whatever. Yeah,
velocity is correct,
velocity, and I just kept running.
That's so good.
Yeah. So and I think I looked absolutely hideous, like doing the old giraffe thing. So no, I didn't hurt myself, but I think I jarred my knee quite bad just from like the trying to stop really suddenly. But
I can hear the slapping of the feet in my head.
Yeah. Oh, this just made me think of one of my coaches fell doing a volleyball drill once, and it was so funny, but he's like this little old man, and he fell, but it's so funny how he fell, because he fell so gracefully on his back. But have you ever done, if anyone's played volleyball before, there's a thing called jousting where two people go up to block, right?
I joust all the time.
Joust all the time, yeah. So he was trying to do a drill where he'd throw it up, we'd joust, and then we'd play it on, and we'd try and pick it up and whatnot. So he was in the midst of it, and he threw it up, and then he tried to get out of there quickly, but he kind of tripped and kept going backwards, and then he did the whole what you did, a bit of a
turtling.
So, but he was okay. But I was just like, oh my god, you okay? Oh man, it was quite funny. But poor guy. But yes,
but he's okay.
He's okay though. Okay. But it was like a bit. You know, when I always laugh.
Oh yeah.
When people fall, and it's
because
so
you
bad.
don't know how to react.
But it's so funny watching people fall sometimes. I'm like, are you okay? But yeah.
But you just don't know how to react.
It's so,
I always feel like if people hurt themselves, not like seriously hurt themselves, but and it's kind of funny, I just don't know how to react. And then I just laugh, and then I'm like, this is not an appropriate time to be laughing at a person. I need to be serious and make sure they're okay. But
what about, have you had any weird ones in clinic where someone's done something and you're like, wow, how the heck did you do that?
I've had weird. I just get weird clients sometimes. I once had a guy, I might have told you, I don't know if I did, but I once had a guy who came in and he's like, I've got a shoulder injury. So this is the consult. I was like, what can I help you with today? And he's like, I hurt my shoulder. And I was like, oh, cool. How'd you do it? He's just like, I don't want to say. I was like, bye.
Sex injury.
That's exactly what it was. He's like, I don't want to say. And I was just
How do you hurt your shoulder doing that?
Because, right, I was like,
what position were
That's
you
what
in?
I was like. I was like, what do you mean you don't want to tell me? I don't know how to help you. I can't tell you what you have or haven't done if you can't tell me how you did it. And he was like, well, it's a sex injury. And I was like, oh yeah, that's fine. Like, okay. And I was like, you don't have to tell me the details. It's fine. But like, what position was your arm in? And like, what happened to it and what did you feel, kind of thing. And he basically was just like, well, I was handcuffed above my head and I think my shoulder twisted and I felt like a pop. And I was like, okay.
Yeah. I know you have not told me that. That's wild. I love that. That's cool.
I was like first year out of uni and I was just like, okay.
Damn. Damn, that's pretty cool.
Likes
yeah.
some kinky shit.
Yeah, that's very cool. That's a
good
cool
on
one.
him.
That's a good one.
On him,
That's actually a good one.
So
somebody call in and tell us your sex injuries.
Unless they're creepy and weird. But like if you hurt your toe or something like that.
Yeah, that's so funny.
Do that. Yeah, that was a weird one. It was weird. I feel like I just get really weird ones.
Anyways, we need more, so please
send us your injury stories. But like tell us with like a little bit of passion.
Yeah, tell us a little bit of detail and passion. That'd be great. Yeah, or even if there's like we've told some that have just been funny falls and funny injuries that haven't resulted in a fracture or anything like that. Like you falling.
What landed you on the sideline?
Yeah. What? Yeah. Why were you subbed out for the game?
Why were you subbed out? Yeah.
Yeah. All right.
That's it.
I think we'll finish it there though for episode. Was that episode 4?
Yeah.
Oh my gosh.
Look at us go.
Zooming through.
We're getting it.
Yeah. All right. Thanks, bench warmers. I was going to say sideliners.
Sideliners.
See you, bench warmers. Bye.